Why should the patient have a CDFE? CDFE is a comprehensive diabetic foot exam. People with diabetes can develop many different foot problems. Even ordinary problems can get worse and lead to serious complications. Foot problems most often happen when there is nerve damage known as neuropathy, which results in loss of feeling in your feet. Poor blood flow or changes in the shape of your feet or toes may also cause problems. It is for this reason that the American Diabetes Association, among others, strongly recommend that your healthcare provider perform a CDFE up to 4 times a year. We recommend it at least once annually. Nerve damage, poor circulation, and trouble fighting infections can make foot problems serious for people with diabetes. Nerve damage makes the skin and nails susceptible to injury. Healing is often slowed down or more difficult for people with diabetes. Skin breakdown can lead to chronic foot ulcers. The goal of the CDFE is to find any changes in your feet as early as possible. In most cases, proper care of your feet can prevent ulcers and reduce the risk of amputation. In order for our patients to receive consistent and high-quality foot care, we've created the following scripts to help you help the patient throughout the diabetic foot care program. The following scripts that have been created are scripts to help you schedule and educate the patient, to pre-screen the patient, an appointment reminder, and then also a post-appointment survey. Script to schedule and educate the patient should go like this. Hello, my name is Ben. I'm from InMotion Foot and Ankle Center, Dr. Rockwood's office, and he wanted me to reach out to you because he noticed it's been more than a year since your last diabetic foot evaluation. It is essential because of your diabetes that you be examined at least once a year to make sure that nothing is occurring that could be more serious at some point in the future. Diabetes can affect many parts of the body, especially your feet, and it's extremely important to ensure that you and your feet are in good health. The next script goes over pre-screening and should be handled like this. Hello, my name is Ben. I'm from InMotion Foot and Ankle Center, Dr. Rockwood's office. I was just calling in regards to your upcoming diabetic foot evaluation, and I was curious if you had a few minutes so we could go over a few questions to save time during your appointment. If the patient says yes, explain the evaluation and proceed to ask the neuropathy and PAD screening questions. If no, inform the patient it is okay, and the questions will be asked during the upcoming evaluation. The next script, reminding the patient about their upcoming appointment. Hello, my name is Ben. I'm from InMotion Foot and Ankle Center, Dr. Rockwood's office. I was just calling you to remind you about your upcoming appointment with Dr. Rockwood in Santa Fe at 10 a.m. Do you have any questions about your upcoming appointment? If yes, answer the patient's questions. If no, okay, well, have a good rest of your day, and we will see you on Tuesday. The last phone script is the post-appointment survey. Hello, my name is Ben. I'm from InMotion Foot and Ankle Center, Dr. Rockwood's office. I was just calling to see how your appointment went and wanted to see if there's anything else I can do to better serve you. Next step in the diabetic foot program is performing the evaluation. First, you should start by getting on the patient's level and showing them the form. They need to see that it is important, a detailed form that should be taken seriously by all parties. And introduce yourself and explain why this evaluation is important. Start out by saying, hello, my name is Ben, and I'm one of Dr. Rockwood's medical assistants. It is that time of the year when we need to perform your annual diabetic evaluation. We are really excited about this new program we are starting because it's going to make it much easier to keep track of what's going on with your feet and make sure no problems are arising. This program is unique to our office, and we see it as a preventative measure. It is our goal to make sure you keep all 10 toes, both feet, and both legs for the rest of your life. The highest cause of lower body amputation in America is diabetes, so it is essential that we stay on top of this. We have found that the best way to make sure your feet stay healthy is to first go over these carefully selected questions with you at least once a year. If the patient was pre-screened prior to coming in for the diabetic evaluation, ignore this step. If not, proceed as follows. The first part of your assessment is a form we are going to work together to complete called the Diabetic Evaluation, Screening and Risk Assessment. After we are done, Dr. Rockwood will be able to tell us whether you are low risk, moderate risk, high risk, or active risk. It is extremely important that we identify your risk so that we know the best way to move forward with your unique treatment plan. We have assembled specific treatment options for each category so that we can do our best to prevent any problems with your feet. I'm going to ask you a series of questions. You may have been asked these questions before, so it might seem redundant. I apologize in advance, but we really want to make sure we aren't missing anything problematic. After you've completed the pre-screening questions with the patient, the next step will be the medical history and complications box. The first question you'll ask the patient is if they have type 2 or type 1 diabetes. The next question you will ask them is how long they've had their diabetes. You will also ask how frequently they get their glucose checked. Also, ask what their HbA1c, also called A1C, is. HbA1c refers to glycated hemoglobin. Ask them the date that they got that checked. Also ask if they're taking any medications to manage their diabetes. The next box is the complications box. Ask if they have any complications with the following: eyes, kidneys, if they've ever been hospitalized, or if they've ever had any complications with DKA, also referred to diabetic ketoacidosis, a condition that leads to a diabetic coma, or passing out for a long period of time. Step is the DM General section. In this section, you will complete as follows. Ask the patient if they've ever had a prior foot amputation. Ask the patient if they've ever had a prior foot wound. Ask the patient if they've ever had a prior pre-ulcerative callus or a callus formation. The next section is the vascular section. First, you will check for pulses in both the left and the right feet and record the results. The Class C findings record if they have an edema in their left or right foot. Also check the temperature in their left or right foot. Check for claudication, hair growth, nail changes, pigment changes, and any skin changes. The next section is the neuro section. You will first begin with using a monofilament, and you will record the number of sites felt in both the left and the right foot. Also check with a tuning fork the vibratory in the left and the right foot. You will also check the reflexes and strength and the gait and balance. One of the last steps is checking for deformity. Please check for the following deformities in both the left and the right foot, and also make known to the doctor the deformities that you think you found. If you have any questions on the deformities, or don't know or aren't sure about the deformity, please ask your medical assistant supervisor or the doctor. The following deformities should be checked: hallux valgus, hallux limitus, hammer toes, equinus, flatfoot, pes cavus, Charcot deformity, bone prominence, or another deformity. The next section is the active foot section. This section should be completed by the podiatrist. This next section is the testing results section. This should be filled in prior to the diabetic evaluation. The results put in this section should be with prior testing results, and the date and the results should be included for both the pseudoscan and the arterial testing, and any other testing related to the diabetic foot. Great job! You've completed the diabetic evaluation. Now that you've completed the risk assessment, the medical assistant should give the assessment to the doctor to complete both the active foot section, the high, moderate, and low risk section, as well as the action section. After the doctor has signed and dated, the MA should also initial, and then the medical assistant is responsible for putting the assessment in the risk assessment basket. In the diabetic foot program is a pseudoscan. After you've completed the risk assessment, let the patient know that since they answered at least yes to at least one of the questions on the screening form, that a pseudoscan will be done. Educate the patient and let them know that a pseudoscan is a non-invasive test that will give us a numerical score on a level of neuropathy in their feet. Let them know that neuropathy is defined as a weakness or numbness and or pain from nerve damage, usually in the hands or feet. The score that this test will give us will help us understand what is going on with the nerves in their feet. We will be able to see if the sugar in their blood from the diabetes has affected their feet at all. The next step in this diabetic foot program is non-invasive vascular testing or study. This has to do with peripheral arterial disease. Educate the patient on PAD. If they have any questions, answer them. We also have a brochure on PAD that can be given to the patient. The next step is diabetic shoes. If the patient is high risk, the patient will most likely qualify for shoes. If the patient is low or moderate risk, still offer the shoes to the patient. Let the patient know that there have been many changes in the healthcare field in the last couple of years. One of these changes that has taken place affects the guidelines of receiving diabetic shoes. In the past, some of these guidelines have not been followed, but I want to make sure that you are aware of the new guidelines that your primary care physician and I will need to follow in order to qualify you to get shoes. Once we make sure that you are qualified, then we will still have to make sure that your primary care physician is aware that we are treating you for this problem and that your primary care physician and I both confirm the presence of these issues. It is possible that you may not qualify for these shoes. In that case, you can still purchase these shoes without insurance coverage. We just want to make sure that we are doing everything we're supposed to ensure that we're following Medicare guidelines and to make sure we are doing it right. This could mean that your insurance may not cover these shoes, and we apologize, but we are really trying to follow these rules that we have been given by Medicare. The last step in the diabetic foot program is the action plan. The action plan is a crucial step in order to make sure that the patient receives the care that they deserve. The two people involved in completing the action plan include the medical assistant and the receptionist. Example is an action plan for low-risk patients. There will be a different action plan in the medical assistant area for all risks, including low, moderate, and high risk. This low-risk action plan should be first completed by the medical assistant. The medical assistant should enter the patient's name, date of birth, and the date of last appointment. The date of last appointment is the day's date that the diabetic foot evaluation was done. Most likely, the date should be today's date. The medical assistant should also put check marks next to the comprehensive diabetic foot evaluation, the pseudoscan, and non-invasive vascular testing. They should check need to schedule. The next step is then completed by the receptionist. The medical assistant will hand the action plan to the patient and inform the patient that they will then take this action plan and show this to the receptionist, and the receptionist will schedule the patient. The receptionist should schedule the patient for the comprehensive diabetic foot evaluation, the pseudoscan, and non-invasive vascular testing. Those should be scheduled every 12 months. The receptionist will refer back to the date of last appointment. The receptionist will schedule these appointments and include the date and time, and also check that these appointments were scheduled. The receptionist will then sign where it says appointment scheduled by. The receptionist will hand the action plan to the patient, but before handing it to the patient, the receptionist will complete in the action plan binder At all checkout desks in all locations, they will complete the patient's name, date of birth, and the date and time, and the checkbox for scheduled for all appointments. On the back of the action plan, there will be education for the patient so that they understand the treatments and the symptoms commonly associated with people with diabetes. You've completed the Diabetic Foot Program training, complete the following: the deformity matching worksheet and also the diabetic training assessment. After you've completed these two, return to your supervisor.